This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Ilara. Today we're looking at a fascinating new study from the journal Neurologia medico-chirurgica, published in 2026. It's titled Outcomes of Postnatal Myelomeningocele Repair in a Japanese Single-Center Cohort, a comparison with the Management of Myelomeningocele trial.
This is a timely paper, Ilara. For our residents and fellows listening, we know the MOMS trial, the Management of Myelomeningocele Study, is the international benchmark that demonstrated the benefits of prenatal or fetal surgery. But there's a geographic gap in the data. Fetal surgery for myelomeningocele is not yet standard practice in Japan.
Exactly. And to move forward with fetal surgery, Japanese centers first need to establish a solid baseline of what their standard postnatal care looks like. This study provides that by retrospectively reviewing 65 patients who underwent postnatal myelomeningocele repair at a major Japanese center between 2002 and 2021.
Let's talk about the patient demographics first. It's important to know if this cohort matches the complexity of patients we see elsewhere.
It does. In this cohort, the myelomeningocele lesion level was thoracic in 18% of patients, L1, L2 in 12%, and L3 or below in 69%. They specifically looked at outcomes for patients who would have been eligible for fetal surgery based on the MOMS criteria.
That's a good distribution. Now, the meat of the paper is the comparison to the MOMS trial's postnatal group. What were the primary endpoints?
They focused on two main clinical milestones, the rate of cerebrospinal fluid shunt placement at 12 months and ambulation status at 30 months. Starting with the shunts, the rate in the Japanese cohort was 88%. When compared to the 83% reported in the MOMS postnatal group, the difference wasn't statistically significant, with a p-value of 0.39.
So, fairly consistent with the international experience regarding hydrocephalus management. What about ambulation? That's often the biggest concern for parents during prenatal counseling.
Ambulation rates at 30 months were 28% in this cohort versus 20% in the MOMS postnatal group. Again, no statistically significant difference there, with a p-value of 0.29. Essentially, the functional outcomes in this Japanese center are largely consistent with the international benchmark set by the MOMS trial.
However, the paper does point out some significant deviations from the MOMS data, doesn't it?
It does, and some are quite surprising. First, the rate of shunt infection in the Japanese cohort was 0%. That's significantly lower than the 9% reported in the MOMS trial, with a p-value of 0.02.
0% over a nearly 20-year period is an impressive surgical and nursing achievement. But there were some areas where the Japanese cohort required more intervention?
Yes, particularly regarding secondary surgeries. The rate of surgery for symptomatic Chiari II malformation was 18% in this cohort, compared to only 5% in the MOMS group. That's a p-value of 0.01. Furthermore, the rate of surgery for tethered cord syndrome was 9% in the Japanese cohort versus only 1% in the MOMS trial, which was also statistically significant at p-value 0.03.
That's an interesting discrepancy. It raises questions about whether those differences are due to variations in surgical threshold, follow-up protocols, or perhaps patient-specific factors. But regardless of the why, this data is vital for our current practice. Why did the authors feel this was so essential to publish now?
Because as fetal surgery is introduced in Japan, you cannot objectively evaluate its success without knowing exactly how your postnatal patients are doing. The authors argue that this data provides an essential baseline. It's indispensable for counseling families who are currently facing a diagnosis of myelomeningocele. They can now be given data that reflects their local surgical environment.
It's a reminder that while international trials like MOMS set the stage, local data is what truly informs the bedside conversation. This study confirms that modern postnatal repair in Japan is performing at a high level, consistent with global standards, while highlighting specific areas like Chiari II and tethered cord management that might require a closer look as they transition into the fetal surgery era.
Exactly. It's about building a foundation for the next step in Japanese neurosurgery.
Well, that's a wrap on this study. Thank you, Dr. Ilara, for breaking down the numbers for us. To our listeners, we hope this helps in your next clinic or when you're counseling a family in the NICU.
Thanks for having me. We'll see you next time on the Neurosurgery Hub podcast.